Hello and welcome to our first lecture, which is called the moral model. In this section, we will learn and we will discuss several theories and models that today's therapy is based on. How they deal, how they work with the addicts, what sort of model, because everywhere there is some sort of model or theory will be based on your work and then you work from there. This is how your knowledge will be based on. Anyway, we will discuss several theories and models, and today we will discuss the moral model, which is not the model that is constructed by today's psychologists or used even by them. Well, anyway, you will see what I mean in a minute. Okay, well, first of all, let's have a look at key items that you will be meeting throughout this course. The first one is addictive personality. It's a concept that was formerly used to explain addiction as the result of pre-existing character defects in individuals. There is a process addiction, which means addiction to certain mood-altering behaviors such as eating disorders, gambling, sexual activity, overwork, and shopping. There is a tolerance notion, which means a condition in which an addict needs higher doses of a substance to achieve the same effect previously achieved with a lower dose. And there is a withdrawal, the unpleasant, sometimes life-threatening physiological changes that occur due to the discontinuation of use of some drugs after prolonged regular use. The moral model of addiction developed naturally as a result of religious and social aspects of alcohol consumption. In the colonial America from the 1620s until 1770s, alcohol drinking was prevalent like at no other time before or after. Alcohol was consumed as a medicine for reducing pain, managing fever, fighting fatigue. Alcohol was used to quench thirst and to energize the body. People were drinking heavily, with wine for breakfast, beers and ciders for lunch, and other various drinks at dinner. Whereas water drinking was compared to something poor people drink, which wasn't that safe anyway. So alcohol drinking was an essential part of social active life then. However, overindulgence of alcohol was seen as something sinful, something compared to gluttony. At that time, people viewed alcohol as a God's given gift, and overindulgence was something like an abuse of such privilege. There were fines and various forms of punishment for alcohol overindulgence. And even today, strictly moral model is not based on science, but rather than on a holistic view of the person and the society, with some added spiritual or religious beliefs in some cases. Strictly moral model views alcohol addiction in the same way as drug abuse, overeating, gambling, pornography, and so on. So the moral model presupposes that addiction is not a result of some type of illness or anything like that, but rather it is a weakness and some default of personality. Those who use this model to view or even treat alcohol addiction see no biological causes for that. They see only a lack in human will, a lack in strength of the character that left the person an alcoholic. You might know people who see alcohol and drug addicts through that moral model prism. But this model is believed to have no therapeutic value for the sufferer. So if you were thinking in the beginning of this lecture that the moral model belongs to the dark ages and religious groups of the past, now you can see that it is still used today, but more in a social or sometimes political context. I personally have met many people who use this model to see other people, and sometimes that involves their family members who became alcohol or substance addicts, and who shame them, giving them moral lectures, and not believing that there might be a biological or deeply psychological problems that are root of the cause. Well, this is what you need to know about the moral model of addiction. So in a nutshell, it is a model that is not proposed by a scientist or a doctor. It was born as a cause of social and religious views when alcohol became a prevalent substance and an essential part of people's lives. And finally, the moral model is still used today, but only in a social or a political context, and never as a therapeutic approach. Well, I hope you enjoyed the first lecture. Thank you for watching, and I will see you in our next video, where we will talk about another interesting model, the psychological model of addiction. See you there.